An operations team for care model innovation is sort of the ground control for the whole process. They don't function as necessarily a group of people who are in charge, but they focus as a group of people who are watching and making sure that the whole care model innovation process is going in the right direction at the clinic. So the operations team might be making decisions, but they're also trying to encourage the teams to make decisions that are moving the process in the right direction. And they're taking the decisions that are made and making sure that that's what's happening all across the clinic. They're ground control, they're a command center, but they're not in command. They're maintaining a command of what's going on around them. The dyad leadership, the medical director and the clinic administrator, of course, need to be participating. A patient care supervisor should be involved. If there's a front desk supervisor, they should be involved because they intimately know the processes around the clinic. And then the medical champions, whether they're physicians, physician assistants, or nurse practitioners, need to participate on the team. And then it's also important to include some of the staff members, key staff members, whether it's from nursing or the MAs or rooming staff or even front desk staff or schedulers. Those people might not be on the team all the time, but they need to come and go on the team as they're used as consultants for their roles or for different functions around the clinic. The role of the facilitator in the operations team is exactly how it sounds in terms of keeping the team focused both within their meetings and between meetings. So incredibly important to keep things on time because it's very easy to wander in these discussions about care model innovation. When people are being innovative, they tend to go off track and 20 minutes later you realize it. So a facilitator is really crucial to keep people focused on what the agenda says or the goals for the day. And it's also, that may be the person that also then facilitates the minutes and the communication around the clinic. So the operations team has responsibility to bring back all of the information they're talking about, determining and learning to their teams. There's definitely a benefit in having some representation on the operations team from each team around the clinic so that that communication is smooth. But then it's also important to connect with the other providers who aren't on the operations team as an operations team member and talk with them about their concerns about decisions that are made and provide some input. Just because you're not on the operations team doesn't mean you don't have an impact on them, and your work is going to be directly impacting the work the operations team does. They wouldn't have a job to do if you weren't telling them what you need. So they're mutually dependent on each other. Before and after starting CMI, the function of the operations team is like night and day because it probably didn't exist before CMI started. So the dyad leadership and maybe the supervisors met in some format prior to CMI. The providers probably met once a month, like most clinics, and the clinical staff probably met once a month, but on their own, separate from the providers, whereas the operations team really brings all those people together in one meeting, just like working in teams brings all the people in a clinic together in one setting. I think for the implementation of operations teams to be really successful, they need to find a way to both communicate within themselves and to communicate to the broader clinic. We set up a plan where we communicate 3 key messages from each operations team meeting to the broader clinic. We post those on iConnect, and we also talk about them in our huddle the next day, so that people know that even though there's lots of people pulled out of clinic, they're actually doing something, and something that relates directly back to their work. And then we take the formal minutes, which may have things that we don't want the broader clinic to know yet, and we keep those minutes internal so we can at least track what's going on and what our next steps are. The tools I think you need are probably the process improvement or process excellence person as a help and as a guide through the process, and then someone who's also responsible for taking notes, posting minutes on iConnect, so a scribe of sorts. Other than that, assigning a person who always plans an agenda or rotating the people who plan an agenda. We feel that an agenda is pretty key, otherwise it's easy to wander into different parts of care model innovation as you're planning the process, but really setting up what's next and what are you planning for next and keeping on those tasks is pretty important. Probably the first and most important challenge to implementing an operations team is getting schedules blocked. That was our biggest challenge. It still is our biggest challenge. Anytime we feel like we have to meet about something new is, well, when? Because we have patients scheduled. So I'd say as soon as you figure out you're putting certain people on a team, start holding their schedule for a little bit longer than you expect to need to, because you can always open it up, but you can't close it. So that's number one challenge. Number two challenge is helping people know that it's important to be there on time, to be fully present. In the clinical day, of course, there are people who straggle in late and who might have to leave for something, but really trying to get people focused on being there and being present for the meeting is crucial. So I suppose some people would worry that it would impact the patient experience negatively because there's less provider access with schedules being held and pulled and staff being held and pulled. We haven't seen that at Northeast. As I've watched our production and our visits over the course of this 9 months, we actually have increased in productivity and increased in volumes during this time. CMI has radically transformed my relationship with my colleagues. I actually get to talk to them every day, all the time. Whereas in my old world, it was me and a medical assistant, and we'd go to town and we'd take a breath halfway through the day, and then we'd wipe our brows and we were done. That was it. And I remember going days without talking to other providers because I didn't have time and didn't have a reason to. Now I get to talk to my colleagues all the time, partly because we're all standing in the same space, but also because we huddle and because there are workflows and processes that we have to talk about. So I feel much more connected to my own clinic and to my colleagues.